Wasim.
So our subject today is an eating disorder, is a medical condition. It's not like any religious lecture, but something maybe, I don't know if you know about eating disorder. Anyone knows about eating disorder? You know, what is it? Allergies?
Yeah,
No.
it's okay.
Allergies.
Yes,
Can
that
be,
counts.
can be,
That counts, yeah.
can be allergy, but it's more than allergies.
Yeah.
Simply, it's just like, yeah.
Yeah, sorry, I don't know if you want me to answer.
Yeah, go
But
on.
it's when someone has like severe problems with their eating, and sometimes like it has to do with maybe like psychological factors that
Sure, yeah.
factor in to make the person have a problem with that.
Excellent, yeah. So it's basically as a food disorder. That's usually people they don't think it's an disorder. It's basically they think it's normal behavior, they denial more or less. This part of it, or could be the reverse. Like they eat too much food and they indulge in change. They don't care about the weight. So two extremes. But it's basically it's sometimes called an disordered eating or chaotic eating. It's common in the community actually. It can range in severity from mild to extreme. On the mild form, like irregular eating pattern, such as skipped meals or yo-yo eating. But the extreme form can be defined as an eating disorder, and that could be a life-threatening. So, eating disorders, they are hard on both physical and mental health. They can disrupt family life, friendship, and everyday's life. Eating disorders, they never disappear without professional help. The earlier the help is obtained, the easier recovery will be. So if someone's thinking about food, eating, and body image, and this start to make them feel bad, it's time to get some help. Okay, so the second one, the risk factor associated with eating disorder, as you can see, is age, family history, excessive dieting, psychological health, and life transition. So usually it happens at younger age group, say between about 1 to 2% of adolescents and young adults, they have an eating disorder. Mostly are females. Anorexia is one of the common term of one of the common type of the eating disorders that happens during puberty. The bulimia is another one that's also common, that happens a few years later in life. Eating disorders, they often develop gradually and may grow out of cycle of dieting. So once an eating disorder gets rolling, it can be hard to stop. So we should pay attention to the warning signs. We'll go through this in the next few slides. So there is no single cause for eating disorder, as you can see. The risk factors are in front of you, and you can see them. So most of the risk factors associated with feeling of low self-esteem or self-worth, feeling a general lack of control, feeling powerless. There is the feeling of a need for perfection, and or sometimes happens with difficult family relationship, or sometimes with history of abuse or trauma. It's more about issues of control and self-worth than about food. So it's usually it can mask other underlying conditions or problems that the people, they think they are coping with this issue through their eating habits. So it's basically associated with an anxiety, obsessive compulsive disorder, and depression. So talk about age, as we said, for the age, as any age can be affected, but mostly in teenage and early 20s, that's the usual age. Family history usually associated with first degree relatives, according to most of the researchers. Excessive dieting can have a positive reinforcement, but can also be a negative reinforcement on that. Psychological health can contribute to eating disorders. Again, as we mentioned, anxiety, obsession, and low self-esteem or depression. Life transitions can happen when, in certain situations, like changes in relationship, death in family or history of abuse. So there are types of eating disorders. The two most common types are the anorexia nervosa and bulimia nervosa, and but there are actually basically six types of eating disorders. The first two are the most common, but the rest are also present, but not like in more. They are not less common than those first two. Anorexia nervosa and bulimia nervosa. There's a binge eating disorder. We go through this one slide, like little definition without any details. There's a pica disorder, rumination, and avoidant restrictive food intake disorder. By the way, do you know if eating disorder mentioned in Quran, maybe?
Start with, does anybody here knows anybody with eating disorder? Do you have friends or relatives or anybody do you think he has an eating disorder? So you might get some help from that. Okay, so you guys, you need to observe more maybe, because it's very common actually.
It's common, but it's also dangerous as well.
Yeah, that's severe. But now you mentioned the Quran.
Yeah. So how about Quran? You know if eating disorder mentioned in the Quran? You think about something in Quran that's talking about eating disorder? Well, there's Surah Al-Amma by full surah about animals and about food, really. So there should be something mentioned in the Quran about it, right? Yeah. So in Quran said, وَكُلُوا مِمَّا رَزَقْنَاكُمْ حَلَالًا طَيِّبًا وَلَا تُسْرِفُوا إِنَّهُ لَا يُحِبُّ الْمُسْرِفِينَ. So basically the israf can be part of the eating disorder. It can be an excessive dieting or excessive food intake. So really everything is mentioned in the Quran. There's nothing like not mentioned. So let's talk about, I think, start with the eating disorder, the anorexia nervosa, which is the most common type, or the most dangerous type, let's say. So it's basically a patient with this disorder. They avoid food, they severely restrict food intake, and they eat very small quantities of only certain kind of food, just like a picky eater, but more intense. So the difference in the situation is that everybody has an eating disorder. You might have eating disorder. It's not an eating disorder. Sometimes you think of, yeah, I want to eat this. I don't like picky eating. It's common in children as well, but it's not like that to the intense. When it's intense, when you start thinking about food, thinking about weight, this food is going to make me obese. Food will make, I want to lose weight to be like models or something like that. So they repeatedly weigh themselves, even though they are dangerously underweight, because they have a denial. They don't understand the situation. So this is part of mental illness, really. So symptoms can happen with anorexia nervosa, like the extremely restricted eating and or intense and excessive exercise. They come with very thin subjects. They are emaciated. They have intense fear of gaining weight because they weigh themselves many times. They have a distorted body image because they want to get perfection. They have denial of the seriousness of the low body weight. So this can lead to health consequences, as you can see that these are some of the health consequences that can lead to an osteopenia and osteoporosis, which is thinning of the bone. It can lead to an anemia because they don't eat well, muscle wasting and weakness, brittle hair and nails, dry and yellow skin, severe constipation, low blood pressure, feeling cold all the time, lethargy or extreme fatigueness. They have brain and heart damages. This can happen from the electrolyte changes. It can affect the conduction in the heart and can lead to some arrhythmias or heart block. And finally can lead to multiple organ failure. So it's really fatal. It can be dangerous. So when we have patients like this, sometimes we admit them to the hospital against their will. We start giving them some fluid to start with and start feeding them. We'll go through the treatment later on as well. So the dangerous part of the anorexia is basically most commonly two things: the starvation and the consequences related to food disorder, and the second thing is suicide, which is the second leading cause of death for patients with diagnosed with anorexia nervosa. The second type is bulimia. Bulimia is, again, it's basically is recurrent episodes of eating unusually large amount of food and feeling lack of control over their eating. This behavior is followed by a compensation for those overeating episodes to prevent weight gain, like induced vomiting or using laxatives or fasting or excessive exercise. So as you can see, this is uncontrolled behavior. This can lead to all these consequences. So people with bulimia, usually they present with, like a symptom-wise, they come with sore throat because of the repeated vomiting. They have swollen salivary glands. They have a decay in the teeth. They have acid reflux. They have intestinal disorders and irritation from the laxative abuse. And they come from also severe dehydration from purging or the use of laxatives. In addition to electrolyte disturbance that can be life-threatening through the changes in calcium, potassium, and other minerals or sodium. The other disorder is called a binge eating disorder. So it's basically the people, they lose control of their eating and have a recurrent episode of eating unusually large amount of food. It's different from the bulimia that because this behavior is common in the two cases, but in bulimia in the binge eating disorder it's not followed by purging or using of exercise or fasting. So people in this case with binge eating disorder, they come with usually overweight or obesity because they cannot control their food intake. The third disorder, or the fourth disorder, is called pica disorder. Pica disorder is eating something that's not considered as food, and that do not provide any nutritional value, like ice, dirt. They eat hair, soap, paper. I mean, you name it, anything that's of no nutritional value. And this can be sometimes can happen in all ages, usually associated with mental disorder or some developmental disorders, and because of these abnormal habits, let's say, or food intake, they can end up with, there's a risk of poisoning from ingestion of these products. Infection can happen, gut injuries, and nutritional deficiencies. In Iraq, we used to have this disorder. People, like when they eat, they go to the clay, they eat clay, like, turban, something. We know they have some disorder anyway. Usually happens with people with iron deficiency anemia. In Canada, they eat ice. They eat a lot of ice because this part of their disorder to either as a source, as a cause, or as a consequence to end up with an anemia. By the way, hair sometimes it can be ingestion too much of hair, especially in females, that can end up with intestinal obstruction because they ingest large amount of hair. They cut their hair and they eat their hair and end up. Yeah, I know you don't like it, right? Yeah, it's not funny, but it's dangerous anyway. I saw some patients, they end up with surgery for that anyway. Yeah.
Do you know like why this happens exactly? Because we know for the other disorders, like people have issues with their body weight and like their body image. So is it the same thing for this disorder, or does this have to do more with like the food availability?
Pica, you mean?
Yeah.
Because basically for food, that's not. It's a subtype of anorexia, so it's not like an usual. They put it as another category for it, but this is not like this, not the way that you mentioned. It's basically the source. Sometimes they just find this more palatable. I don't know, the ice or the clay or the dust, whatever.
Do they like this stuff because it looks colorful or something?
They like it. They like it. We don't know why, but that's they're in their mind. They like it. But that's the idea. It's extreme. It's always there are some picky eaters, but there's an extreme of picky eaters. So these are talking about extremes. Again, there are mild cases, there are extreme cases.
Wait,
We're
how are
talking
they
about
picky eaters if they eat hair?
The picky eaters,
So they
it's
try-
part of it, but could be more
No,
than
'cause
that
they
anyway.
don't eat food. They only eat.
Yeah. They eat paper,
Um,
they eat hair, they eat paper, they eat
No, I-
soap. So whatever they find, sometimes they eat. That is, it's just to express their need for something to fill their mind with something.
They need to release their stress. They need to
have
release
stress.
their
They go
there's
to
something
anything they
they're
find.
missing, and they find this is the coping mechanism for it, and they go for it. The problem is you don't notice until they build up slowly, slowly. Start with a lick, and he feels better after it. Then he will go with a spoon. Then he will go with a mug, and he will do daily instead of once a week or something. And that's when you notice, okay, this is something we need to
You need to
stop.
know.
And that's when friends, family has to interfere. Because never gonna start like a surgery case, it's always start with the tiny things, and it's built up until it goes to the extreme. So anybody who has something, by the way, every human being will go through this, but in a mild version. When you don't like cucumber when you're 2 years old, but you're gonna like it when you're 10 years old. You don't like this
Don't
when
like
you
it at all.
do this when that. That's
doesn't
normal.
like it at all, anyway.
That's
Yeah, I
all
don't.
normal. See, everybody will have some food you don't like to eat, but it's
The
mild,
extreme, it's
it's
the extreme.
normal, it's the
Yeah.
extremities when it's dangerous, that's it.
So they're addicts to.
Yeah, exactly,
Yes,
nice word, yes.
yes, you can say that. So the fifth type is rumination disorder. There's like a person, they start regurgitating their food actually. It usually happens in children. They start regurgitating their food, they chew it and then re-swallow it or spit it out. He does not like it. Okay. Well, that's how it comes, I mean, it's not my idea. So it happens up in the first 30 minutes after meal and happens in infancy, childhood, or adulthood, and can lead to severe weight loss and malnutrition. So it's not something to mention in Ramadan. Let's go for anyway.
Yeah, you go ask questions, she has
Yes.
question.
Yes,
So
sir.
what they do is that they keep on spitting it out and eating it, and then they just leave it on the food.
They can, yes. I know you don't like it, but this is how it is. I mean, we are talking about extreme things, not minor, not simple things. So the avoidant or restrictive is part similar to the another selective part of eating disorders. So people limit amount of type of food that they eat with no distorted body image or fear. This is the same as the anorexia, but there is no distortion of the body. They don't weigh themselves. They don't indulge in exercise or think about their weight too much. Usually happen in middle childhood. They are picky eaters, but they do not eat enough calories to grow, so they are malnourished usually because they avoid certain kind of food. So that's why called an avoidant or restrictive food intake disorder. It's getting more fun now, right?
And discuss.
Yeah, no, we'll leave it. Finish. That's all. That's all the types. So treatment, as we mentioned before, it can be treated successful with involving family members. Could be a partial part, psychotherapy, medication, nutritional counseling, and treating underlying illnesses. So early detection will end up with full recovery. A person's family can play a crucial role in the treatment, and family members can encourage a person with eating disorder through help. They guide them. They provide more support. It's very important part of treatment of these eating disorders. Sometimes they incorporate the family. You incorporate family into the treatment of eating disorders can improve the outcome of these disorders through the way of restoring adequate nutrition, bringing weight to a healthy level, reducing excessive exercise, and stop the binge and purge behavior. Other mental disorders, and as we mentioned, anxiety, depression, need to be treated as well, and it's also a critical part of treatment for eating disorders. Now, it's very complicated. So it's basically they have a teamwork really between physicians, dietitians, counselors, psychotherapists, because we don't want to lose people in their teenage for some eating disorders like anorexia or something like that. fatal, it's dangerous. Treatment, it can take several, actually, the input is to be accepted in this eating disorder can take sometimes up to 2 years because they are very busy. So imagine the number of people who have eating disorders and they are just on the waiting list to be seen. Like that's actually in Newmarket, like in South Lake Hospital. Recently I had a patient, he's in his 30s and he was involved with alcohol and eating disorder. He was involved with exercise, excessive exercise after food. I did send for an eating disorder clinic in Toronto General. Also the waiting time, was amazing really. It takes about 5 months to be seen. So that's also that's could be very late for a patient that's always admitted to the hospital for the same condition. Like every month they are in the hospital for the same reason. Dehydration, low electrolytes, some electrolyte disturbance, heart problems. That's really not really fun. Okay, so we have some questions about teenage. Are they affected by eating disorders? Probably, yes.
Peer pressure?
Huh?
Peer pressure?
Peer pressure, yes, can play part in it as well, yeah. It's family relations, right? So the question is, are teenagers affected by eating disorders? Probably is yes. This is because of the hormonal change that happen during the pre-puberty and their social pressure to look more thin or attractive. These changes can be normal and may only, some teenagers, they may practice unhealthy eating habits every once in a while. So that could be normal. When the extremes, that comes to an eating disorder. So if the teenager involved in begin to be more obsessed about weight, appearance, or diet, or start consistently eating too much or too little, this can be a hint towards an eating disorder. So abnormal weight loss or weight gain may also could be a sign of an eating disorder, especially when a teenager frequently involved in making negative comments about their body or their size. So if you know someone that has eating disorder, you should be open, honest, and about your concern. They should establish a good relationship and make sure that they see their doctor, counselor, or therapist. As we mentioned before, this could be dangerous as well. So the second question is, are men affected by eating disorders? What do you think? Yes. Is it as common as female?
No.
No, it's not common as female. Yes, that's right.
Probably because of the media.
Huh?
Probably
Media.
because of the media, because all the models, every woman
Yeah.
has to be thin, so peer pressure, media pressure, but the men because of the depression and because they feel frustrated, so they go to the other type where they just eat and they don't care until they go bigger and bigger, and you know what, he's humorous, he's funny, he's big, but he's this, he's big, but he's
Different,
that.
yeah.
So it's different reasons.
So as I mentioned, women are usually most commonly affected by eating disorder, but men are not immune, of course. Men usually are underdiagnosed and undertreated, because usually the men think of themselves, this is an eating disorder that is specific for women. It's not like for men. So that's what they feel in their minds anyway. So some men, they suffer from something we call muscle dysphoria, muscle dysmorphia. So muscle dysmorphia is an extreme desire to become more muscular, bulky, while most women, they think about themselves losing weight and become more thinner. This can lead, they can hurt themselves by gaining weight or increasing their muscle mass through a dangerous behavior like steroid use or drugs to increase their muscle mass and become bulky. So research found that young men with eating disorder, they don't seek treatment because, again, they consider eating disorder as stereotypical for female disorder. It's not like male disorder. So how can we help someone who has an eating disorder? It's basically through talking to them, establish a good relationship. conversation also can be difficult because eating disorders can trigger negative emotions and make someone feel defensive about their eating habits. But listening will improve everything and makes them healthier as well. So that's part of the family, friendship, and other relationship with people with eating disorder. So how about if there's a Muslim patient with eating disorder? So as you know, in Muslim Ramadan, that's it could be conflicting, could be challenging, because the daily cycle of fasting and eating, this makes the patient feels the need to restrict their food intake, eat large amount at one time, and purge maybe after eating. So while Ramadan is meant to be a challenging in many ways, it isn't meant to be to have a negative impact on the mental or physical health of a person. So there are 5 tips to.
Before that, we have a question.
Oh yes.
So people with anorexia, do they have to fast?
They have to fast.
Yeah,
What do you mean by have to fast? That
If they Muslim.
religiously speaking,
Yeah, they have.
they have.
There's, it's not
They
an
have. There's no
excuse.
other excuse. Yes.
Because like if they're already like thin and they're gonna
Yes.
become thinner.
Well, that's why we help them so that they can reach the stage, right? So Ramadan has a special relation with people, right? So Ramadan has spiritual, it has also mental connection as well. We'll go through that as well. So during Ramadan, people with eating disorder, they should set boundaries. So that, you know, when you go for iftar, it could be a social event, right? Some people with eating disorder, they don't like these events. So sometimes we tell them, okay, don't attend. And don't be offended by those comments that the people use for eating, for iftar, for example. So setting boundaries may involve choosing not to attend dinner parties, or excluding themselves from conversation about food that makes them feel nervous or anxious. But that does not mean that you miss out the social elements of the holy month. So making time for suhoor is very important time, because that's you need to consider meals that are rich in protein and fats and complex carbohydrates, so that you can give you the strength and power to fast your day. So in Ramadan, you're keeping a Ramadan reflection journal. So a journal really is also part. It's give you like what point of strength, what things that you have did before that helped you, and things that maybe you need to improve with time. So Ramadan requires a lot of strength and determination, and can be more intense in patients with eating disorder. So journaling may be a great way of identifying and keeping a track of how well they are doing during that holy month. So seeing Salah as an opportunity for mindfulness. So Salah can provide a great opportunity to take a break from your daily task and find time in mindfulness. Salah time could look like seeking out a quiet place to pray, taking your time to be in contemplation and focusing on your movement. There's a study in 2017, they found that people who regularly offered prayer while incorporating mindfulness, they experienced better mental health than those who did not incorporate mindfulness. So that's how Salah is important, really, whether in Ramadan or outside of Ramadan. Having a prevention plan ready. It's basic to prevention plan can start even before the holy month or during the month. This can be part of the plan, can be knowing the triggers and try to avoid them, coping strategies that have worked for you in the past maybe, and new tools that you can implement to reduce the chance of experiencing a setback. And people can rely on challenging situations such as beloved ones or their therapist as well to help them. So during Ramadan, where people they can volunteer their time, because during that Ramadan there's it's a month of charity, as you know. So sadaqah, for example, financial donation. It can also involve volunteering your time for community projects, increase your acts of worship, and spending more time in a prayer, be in a great way of to help more as part of Ramadan, and learning more about Ramadan, which can be a great time to learn about your religion, about your Islam, reading, attending religious lectures, and have your family and friends around you. I think by this we end up all the subject about eating disorders. I hope it wasn't that boring anyway. All right, good. So any questions? Anybody have questions? All right. Any comments or any questions, guys?
So do they know how to screen now for people at home or friends? Do you know who might have some eating disorder? Because that's the most important thing, is to help people before they get bad. And this is the things, like 15 years old, I will say male instead of female, tell his mom, I'm not hungry, I don't want to eat. No breakfast, no snacks, no lunch. He might have half a toast, and at night he goes to bed. And this cycle not for a day, this is for every single day. And he start to be thin, but he's tall, stretch. His hair start to be dry, his skin start to break, his nails start to crack. He doesn't go to the washroom so often. He goes once in a week, once every 2 weeks. But he cannot eat. He cannot. You can, no matter what you put in front of him, he cannot drink Ensures or Gatorade or whatever. He cannot chew. He just gonna vomit. He gonna feel nausea. He doesn't want to. So this kind of people, they need help. Other people who just eat with no time. Eating in the morning, snacking 2 times, taking their lunch, snacking 2 times, having their supper, snacking 2 times. Before they go to bed, they eat, they keep food under. So these are the tips that you should look for, the mom, the dad, the sisters, the
Friends.
brothers, friends. That's when you should ask the first things, do you know why you cannot eat? Or do you know why you're eating in this pattern? Do you find yourself, these people comes, they're 50 kilos and they're 7 feet height, and they come, we said, when we look to the mirror, we find ourselves so big. You bring their clothes, their pants, and you show to them, look at this size, measure it, and they still cries and they say, no, we're so big. That's how do they see themselves. So you link the appetite, you link to how do you see yourself in the mirror. The third one, the most important one, guys, you should be very nice on making comment at school. If somebody cannot run because his body habits, body shape is a little bit different than others, don't make fun, don't call fat, don't make things. Everybody's different. Because he will take it personally. He will start binging or start hoarding or starting doing things. You can damage a human life easily with a word. Be nice. Don't call names, please. You can have a lot of fun in different ways. Never destroy body image of others. This is the biggest problem ever. All these kids coming to clinic asking for help because of the negative impact from school. The girls, oh, this fat one, oh, the big one. The boys, oh, this is skinny one because he doesn't have muscle. Oh, he doesn't have beard yet, he doesn't have all of this. Keep it to yourself. Don't talk about this. Talk about positive things. The body shape, the body habit, it's not your business. What you see from that people, his behavior, his akhlaq, his attitude, that's the most important thing. Now, you can help friends not to go to the extremities with a positive comment, with being there for the friends, but don't have a bad impact on friends. That will be very bad. Don't do this. Because this is the most important, out of this lecture, this is the most important tip you should do. Don't say bad words for others. Don't comment on behavior of others. At home, we know that. At home, brothers, sisters, or who you're calling names, make sure it's not about body or color or hair type or something like that. Pick on your sibling in different way. Don't do this way. Especially from a sibling. It's gonna stay in the person's heart forever because it hurts. And that person will take it deeply and can grow. And imagine if you damage your brother or your sister forever. Nobody can heal that. No one. Because what foreigner gonna do if a brother or a sister hits? That's very bad. So this is the most important message. Be kind. End of story.
I told you should be here. How many times I said that?
No, you're doing good. You're good.
Thank you very much. Yes.
It
Okay.
was good actually. It was really informative. Like I learned a lot.
Nice.
Oh, that's
Good to know.
nice.
Thank you very much.
Good, yeah.
Well, the, yes.
شلون نقدر نساعد يعني لو نقول بيكي او
Picky eaters, yeah.
وبنفس الوقت يعني ياكل بس الطفل يعني خلينا نقول تينيجر
Yeah.
ياكلون بس اكل مو صحي وبنفس الوقت بيكي شلون نقدر نساعدهم؟
هذا أصعب سؤال ممكن واحد يواجهه بحياته كلها يعني.
So
Yeah. It's,
it
yeah.
depends on the age. It depends on the age. If they're picky eater early, rewarding system. Rewarding system. You give them, let's say, salads. You're gonna okay, tomatoes and lettuce enough. If you're gonna eat one piece, you're gonna go to do this or do. You're allowed to do this.
هو شوية العفو مو يعني
If it's if you have
هذه هرمونال تشينجز يعني مرات تصير تبدي هرمونال تشينجز سو يعني عادة احنا نتركهم عادة يعني من لا يعني distract their attention away from food لا تخليهم يفكرون بالفود لا يفكرون بشيء ثاني يعني فود اذا انت تركزين على الفود هو يركز على الفود راح تصير بالاخير راح يوصل الى موضوع الايتنج disorder بس احنا نريد نوصل هذه المرحلة نوصل الى مرحلة قبل هذه المرحلة نلغي هذا الموضوع ما نريد نوصلها اصلا يعني فاحنا نخليهم مثلا اوكي انت تريد اكو ايتنج ديس اوردر اكو لا هذا ما تريد اوكي نو بروبلم عندهم هرمونال تشينجز سبيشال بالتين ايج عندهم هرمونال تشينجز difficult to control يعني so عادة most of the time we leave them but we observe them يعني عادة نراقبهم اذا طلعوا عن الطريق لا نحاول نرجعهم again rewarding system ماكو argument لازم no argument يعني argument will be like will lead to a wrong direction definitely wrong يعني 180 درجة يتغير الموضوع
عندي سؤال إذا طفل عمره 7 سنوات وهو مريض عنده مرض مثلا بالمعدة أو بالقولون شلون نخليه يلتزم قدر الإمكان وهو طفل يعني كل شيء يشوف فيه ياكل أو يتدور
هو الطفل صعب تحافظ عليه يعني مو سهل انه الطفل تخليه مثلا ياكل انه هذا يقول لازم تاكل هذا صحي هذا مو صحي يعني فاحنا نخلط بين الاثنين انت شويه منها مثلا شويه منها ريوردنج سيستم خلينا نقول يعني انت مثلا هذه منها نقول له شويه اذا تاخذ هذا اعطيك هاي شويه من عنده بس ما نقدر نعطيه اكثر نقول لا لازم الا تاكل هذا الهيلث فود وتعوف هذا الفود هذا نوت هيلثي بس شويه منها يعني هي بالانس بس مو ما تقدر تسيطر عليه بهالطريقه هذه لانه بعدين راح يكره الاكل ويتجه الى disorder يعني.
Another tip, if he has siblings, or of course the parent in the house, they have to be supportive. هم لازم ياكلون الأكل هو ياكل. They have to sacrifice, so he doesn't feel he's different.
يعني مو واحد
He has
ياكل
to
لوحده
blend
وخلاص
in.
يعني.
مو أنا أنطي لعلي خلينا نقول هذا وذاك وأنت لا you have to eat it because you're sick. No, that's wrong thing. هذول كلهم خلينا نقول السيلياك ديزيز مثلا اللي هم جماعة الطحين اللي ما يقدرون ياكلون وما أدري شو. ما يعني اكو ناس يقول خلاص احنا ما راح نجيب الخبز بالبيت، الخبز العادي ما يوصل للبيت، حتى الكل ياكل شيء، حتى هذا الطفل يكبر شايف امه وابوه واخوته they eat the same thing as him so he doesn't feel different. بعدين من يروح المدرسة من يروح اليونيفرسيتي he find he's okay he's fine he's already grow up with like this is all the food I can have and my family was fine. يعني منا اذا خربط شويه هيك شويه هيك is okay. بس ما انت
طبيعي.
تجيب طفل وتقول له ممنوع انت تاكل بس انت، هذا اكبر غلط. No, you can't.
راح تؤدي الى نتائج عكسيه يعني. يعني disorders. خصوصا بهذا العمر الصغير، يعني هذول الاطفال بالعمر
هو لين
بعد
عمره
ال5 ل6 سنوات الى يوصل الى المرحله بعدين البيوبرتي هذه من توصل لازم قبلها يعني ما توصل الى هاي المرحله، ما يوصل البيوبرتي بعد ما يقدر يسيطر عليه. لان تبدي الهرمونز تشتغل بعد difficult.
وشنو يحب هو مثلا الطفل مثلا اذا ميل نقول له اوكي انت ما تريد تصير مثل بابا او جدو، شوف شلون لحيته ثخينه، شوف شلون شعره، شوف شلون عضلاته. give him something that he can look for it. يبا اوكي اذا اخربط ما راح
فكرة.
اكبر، ما راح
فكرة.
اطول، ما راح اسوي، خلي اكبر، هيك شويه منا شويه منا مشي ويا الاطفال لانه you can easily guide. شو من يكبرون صعبه بس
صعبة.
الاطفال
هي الاطفال اذا قال لي I don't like it شو تسوي؟
يقول له what other option عندك مثلا فتشيل اخضر، شنو تريد عندك؟ لازم تاكل اخضر، شنو الاخضر؟ اختار واحد من الاخضر.
هي صعبة.
خلينا نقول هي صعبة مو سهلة،
مو سهلة،
لذلك
لا،
الفامily
أبداً مو
has to be
سهلة.
on board.
صح.
The family has to be on board. That's very صعبة.
كل القصة